Now, the next item of business is a statement by Tom Arthur on youth mental health support. The Minister will take questions at the end of his statement. Therefore, there should be no interventions or interruptions. And I call on Tom Arthur, Minister, up to 10 minutes, please.
Thank you, Presiding Officer. My statement today concerns the lasting legacy of the Youth Commission on Mental Health Services, which reported in 2019. I begin by thanking Young Scots, Sam H and the Children and Young People's Commissioner Scotland for their recent report detailing progress against the Commission's recommendations. The opportunity to give this statement today is therefore very timely. Presiding Officer, the Youth Commission's work remains at the heart of this Government's approach to children and young people's mental health and well-being. The Commission was part of a sea change in how we think about support for children and young people's mental health. The Commission had a primary theme that support should be available across the whole system at all levels of need. And that is at the core of our current mental health and wellbeing strategy. The strategy sets out our shared vision of a Scotland free from stigma and inequality, where everyone, including children and young people, fulfils their right to achieve the best mental health and wellbeing possible. I believe it reflects the Youth Commission's ambition for children and young people's mental health. This includes the strategy's focus on the 3 Ps: promote, prevent, provide. It is clear that the Commission was a catalyst for so much of the change we have seen across the system in intervening years, and I will give some examples shortly. And it was a great example of young people directly driving meaningful improvements on the issues that matter to them. And on that note, I give my heartfelt thanks to the many young people who shared their personal experiences. They demonstrated tenacity, candour and passion to improve the services they access. Their work, and that of the many young people who followed them in sharing their views and experiences, continues to influence policy 6 years after the report's publication. I therefore hope the members of the Commission are very proud of what they achieved. Presiding Officer, we accepted the vast majority of the 103 recommendations made by the Commission. But as the new progress report acknowledges, the landscape has changed significantly over the past 6 years. The time between then and now spans 2 parliamentary terms. We have had a global pandemic. NHS spend on mental health has increased dramatically. We have published 2 national strategic mental health documents. I could go on. The latest report highlights the difficulty of progress reporting against previous recommendations, which themselves have resulted in huge change. And that is why I wanted to focus on the Commission's lasting legacy during my statement today. It is only right that we reflect on its achievements, and I would like to do so with reference to each of the Commission's 5 key themes. The first theme focused on services. The recommendations directly influenced the development of the National CAMHS Service Specification, published in 2020. This outlined the standard of support that young people and their families are entitled to expect from the NHS. Key principles of the specification include equity of access and a needs-led and rights-based approach aligned to GIRFEC. We have invested significantly in CAMHS improvements in recent years and continue to work both with health boards to closely monitor implementation of the specification. In line with the Commission's recommendations, it states that CAMHS must work in partnership with children, young people and their families in all aspects of service design and delivery, including transition planning. We have also seen considerable improvements in CAMHS waiting times. The 18-week standard has now been met for the 3rd quarter in a row, with 91.8% of children and young people starting treatment within 18 weeks of referral. Local CAMHS teams continue to respond well to demand, with 1 in 2 children and young people referred to CAMHS starting treatment within 5 weeks, compared to 12 weeks pre-pandemic. This is the result of sustained investment by this Government and, even more importantly, the continued hard work of our amazing CAMHS workforce. CAMHS staffing levels have increased by 54.3% in the last decade of this Government. And we have also exceeded our commitment to provide funding for 320 additional staff in CAMHS by 2026, increasing capacity for cases by over 10,000. The Commission's second theme, education, called for a whole-school approach. We have ensured access to counselling services in secondary schools across the country, and continue to support local authorities with £16 million every year. We subsequently published a whole school approach framework to assist in supporting children and young people's mental health in schools. The third theme called for more community-based approaches to support mental health. We know that not all children and young people who need support will require a specialist service such as CAMHS. This is why we have provided local authorities with more than £80 million since 2020 to fund community-based mental health support for children and young people, including £15 million per annum baselined in funding from 2025-26. Community-based supports are now available in every local authority area, and councils report that they were accessed by nearly 80,000 people in 2024-25. Young people aged 16 and over can also access projects supported by our community's Mental Health and Wellbeing Fund for adults. We have invested £81 million in this fund since 2021, with a further £15 million committed for 2026-27 through our third sector fairer funding pilot. Our substantial investment in community-based support brings me to the next Youth Commission theme: finance, policy and rights. As I mentioned earlier, NHS mental health expenditure has risen substantially in recent years, from £1.3 billion in 2022-23 to £1.49 billion in 2023-24 alone. Despite facing the most challenging financial situation since devolution, we have also doubled the direct programme budget for mental health since 2020-21, allowing us to build on the improvements we have made in early intervention and prevention, as well as clinical support. Again, let me be unequivocally clear, the mental health budget for 2025-26 remains at £270.5 million. Between the Scottish Government and NHS boards, we expect spending on mental health to be around £1.5 billion in 2025-26. The Commission's report emphasised the importance of young people being at the centre of decision-making and supported to understand their rights. This principle of meaningful participation is central to the adoption of a children's rights-based approach. It is a guiding general principle of the UNCRC. Scotland is the first country in the UK and the first nation in the world to incorporate the UNCRC into domestic law within the limits of devolved competence, providing legal protection for children's rights. Further building on the legacy of the Commission, we continue to ensure the voices of children, young people and those with lived experience are central to policy development. For example, through our Joint Strategic Board for Mental Health and the Youth Reference Group, which supports our work on suicide prevention. In its final theme, the Commission rightly acknowledged the need for training the workforce to better meet the needs of children and young people. Our Mental Health and Wellbeing Workforce Action Plan sets out a range of actions to address key workforce issues, including training. In 2025-26, we provided NHS Education for Scotland with over £30 million to continue multidisciplinary education, training and supporting workforce expansion, including for CAMHS. Despite the substantial progress I've set out, we are not complacent, and I acknowledge that we have much more to do. And that is why we are working with partners to refresh our mental health and wellbeing delivery plan. The next delivery plan is scheduled for 2026 and will contain a focused selection of strategic actions that will enable us to make significant progress towards our overall vision for health and social care reform. I want the delivery plan to show a clear and tangible contribution to not only the mental health and wellbeing strategy, but also the service renewal framework, the population health framework and the NHS Scotland operational improvement plan. I recognise also the importance of ensuring government learns from our incredibly valuable partners who are working on the ground and in communities. For example, I know SAMH is about to shortly open its Nook Hub in Glasgow, which will be an integrated community-based site, which will bring together other stakeholders from across the city and will be open to people aged 10 and upwards. And I very much look forward to visiting the Nook and learning from this new innovative approach being taken by SAMH. Presiding Officer, I finally wanted to briefly touch on neurodevelopmental support following my previous statement to Parliament in June. Whilst I of course recognise that neurodivergence is not a mental health condition, I would like to briefly reaffirm that we are continuing to take action to support people with neurodevelopmental needs. Improving support for children and young people is a long-term commitment. And although we are still at the early stages of this work, we are providing funding of £500,000 this year to improve ND assessment and support for children and young people. In conjunction with COSLA, we have also undertaken a review of the implementation of a national neurodevelopmental specification. This will inform improvements to ensure health boards and local authorities are delivering the specification in full. We have also established a new cross-sector neurodevelopmental task force, which met for the first time on 2 October. It will be key to taking forward the actions identified in the review. Presiding Officer, I end by reminding colleagues that tomorrow is World Mental Health Day, making it an ideal time to reflect on the progress we have made and the work we still have to do. I would like to again give my thanks to the Youth Commission members and to Sam H and Young Scott. The lasting legacy they have created continues to drive our approach to children and young people's mental health and well-being. I look forward to members' questions.
Thank you. The Minister will now take questions on the issues arising in his statement. I intend to allow around 20 minutes, after which we'll need to move to the next item of business, encouraging members to press the request to speak buttons if they wish to ask a question. And I call first Brian Whittle.
Thank you, Deputy Presiding Officer. Can I thank the Minister for early sight of his statement? I think the rise in poor children's mental health is to be one of the most concerning health issues we face in Scotland, in an environment where poor health outcomes are too common. Scotland has had a significant spike in the need for CAM services, along with a massive jump in ADHD, autism and neurodivergence referrals. But we even have situations where some health boards cannot disaggregate CAMS numbers from neurodivergence numbers, and that cannot be allowed to continue. I mean, how can you solve an issue if you don't understand the problem? We also have a third sector which we rely on so heavily on its knees, with many essential mental health services in danger of disappearing, further exacerbating the pressure on our statutory services. I was at the Voluntary Health Scotland Manifesto launch last week, and their key theme is one of prevention. We need a significantly better interaction between third sector and statutory services, with an emphasis on prevention. So it's great that the councils have more money, but what assessment has the Scottish Government made of the impact on the ground? Because we've seen many leisure centres, pools and community halls shut due to local government funding, those spaces that provide the very first line support services for our kids, that of inclusion and secondary and outlet. Secondly, the Commission on Mental Health Services made its recommendations in 2019, but last month the Children's Commissioner said evidence of progress by the Scottish Government in many areas is seriously lacking. So what guarantee do we have that the Government will finally deliver after 6 years? And finally, Deputy Presiding Officer, the Children's Commissioner highlighted last month that key commitment was made by the Scottish Government that at least 1% of NHS funding should go towards young people's mental health services, and it has not been met. Will the Minister commit to delivering this promise by the end of this Parliament?
Minister.
Can I thank Brian Whittle for his questions. I'll take each of them in turn. He made reference to the point with regards to impact on the ground. As I touched on, since 2020, there's been £860 million invested in community mental health services from two funding streams, one for children and young people and one for adults. And the funding with regards to children and young people, as I touched on in my statement, has been baselined into local government funding. There was a framework published around the time of the inception of that funding, setting out the types of interventions that funding would help to support in terms of setting out the vision of community mental health support. I think, for me, the evidence that we have seen today in terms of the number of organisations who have been able to secure funding and deliver projects on the ground locally, and the point I made with regards to around 80,000 people receiving support in the last year, for which we have data, demonstrates the significant impact of that funding. And of course, we continue to engage with partners and local government to understand what further action can be taken. With regards to the point around progress on the Commission, as the Commission report acknowledged, and as I touched on in my statement, there has been a sea change over recent years, not least the impact of the pandemic, and onto a second mental health and wellbeing strategy. And I think the actions that I've set out demonstrates the recommendations that were core to the Commission, which the Government either accepted or accepted in principle, have strongly informed both our strategic position and indeed the actions being taken forward via the delivery plan. And with regards to the point on CAM spending, we recognise that commitment, and as I say, we are committed to working constructively with our partners to ensure that we can deliver on that 1% commitment on CAMs and indeed the 10% commitment on mental health.
Sweeney.
Thank you, Deputy Presiding Officer, and I'd also like to thank the Minister for advance sight of his statement. I think we all agree that the current system for young people seeking mental health support is broken and it must be transformed. I just came from the Bipolar Scotland conference in Edinburgh this morning, where there was broad agreement that prevention is often ill-recognised and poorly resourced, particularly by irrational and incoherent decisions made by integration joint boards in allocating budgets. First Minister's questions earlier, the First Minister told me that the Government was on track to meet its commitment to spend 10% of the National Health Service budget on mental health services by the end of this Parliament. So does the Minister agree with the First Minister that that will be achieved, and is he willing to be held to account for that specific commitment?
Minister.
The First Minister set out very clearly what the Government is pursuing and that we're on track to achieve that goal. And as I stated in my responding to questions in my statement in June, I made that commitment that we would work constructively with health boards to support that delivery, because as a member will be aware, there is variation between health boards in the total percentage of resource being allocated for mental health, and I would make that commitment again of being working constructively with health boards to achieve that. On his point around prevention, that is absolutely important. It is at the heart of the population health framework. Indeed, it's a core component of our mental health and wellbeing strategy, indeed seeking to promote positive mental wellbeing, but also to prevent, and indeed where crisis and need develops, to be able to provide the required support.
Jackie Dunbar, to be followed by Annie Wells.
Thank you, President Officer. Can the Minister say any more about the steps the Scottish Government has taken to deliver improvement across waiting lists for youth mental health services?
Minister.
Yeah, we're taking a number of actions. There has been significant investment in resource over the past decade, as I touched upon in my statement. Indeed, a rise in CAMS staffing of some in excess of 54% and significant increases in our mental health budgets. And we're seeing that reflected in the CAMS performance, with the third consecutive quarter of exceeding the national target, and indeed with a median wait of 5 weeks for people to begin treatment after referral.
Annie Wells, to be followed by Evelyn Tweed.
Thank you, Presiding Officer. Minister, Glasgow families have been left deeply concerned by the closure of the Notre Dame Children's Centre earlier this year, a service that supported some of the city's most vulnerable young people. So how can the Minister claim real progress when trusted community-based services like this are closing their doors due to funding pressures? This is leaving children without the help that they desperately need.
Can I say I recognise the importance of the issue that Annie Wells raises, and I know that other members will have concerns that are with regards to decisions that have been taken locally. These, of course, are decisions that are being taken locally under the existing statutory frameworks. What I will say is the Government is committed to ensuring that we engage constructively with partners. We do have record funding allocated this year for our health boards and for local government, and as I touched on earlier, we have provided in the region of £160 million over the past 5 years for community-based mental health services.
Evelyn Tweed, to be followed by Pam Duncan-Glancy.
Thank you, Presiding Officer. The transition from child to adult mental health services can be a worrying time for both young people and their parents and carers. What assessment has been made of the support required for those transitioning from youth mental health services to adult services? Minister.
Well, the question of transitions is an extremely important one. Indeed, it was one of the recommendations in the Commission's original report. That obviously came following the publication in 2018 of the Transition Care Plan guidance. That informs our approach to CAMS, and indeed there is that flexibility there that in reaching 18 years of reaching 18 years of age doesn't necessarily mean moving immediately to adult mental health services. There is the flexibility for that to be vary between 18 and 25. Of course, that responding to the specific needs of the individual young person. So that is what, in terms of, is included within the national standard, and it is, of course, for local partners to ensure that that is being delivered.
Pam Duncan-Glancy, to be followed by Claire Hawkey.
I thank the Minister for advance sight of the statement. It will be disappointing, I think, to parents of and the young people themselves with ADHD across Glasgow that the Minister's statement only really mentioned those issues related to ADHD at the very end of the statement, and even in the very broad terms. A constituent in Glasgow has struggled to be assessed for ADHD for almost 2 decades now. Her assessment was first requested as a young child in 2008, and she spent the intervening years being passed from pillar to post. She's not alone. Current waiting times mean that people assessed this week are likely to have waited over 3 years to be assessed, leading to a lifetime of uncertainty with untold consequences. So can I ask the Minister, what is he going to do to urgently ensure a timely pathway for support and diagnosis for young people with ADHD?
Minister.
I recognise the primacy of this issue and the importance of it, and that's why I set out the actions that the Government is undertaking in a statement, a substantive statement to Parliament prior to summer recess. And indeed, the substance of my remarks was focused on responding substantively to the Youth Commission report, but I felt it important to provide a further update to Parliament with regards to the work we are doing around support and assistance and assessment regarding neurodevelopmental conditions. We recognise that we are contending with an extremely, to use the words of the Royal College of Psychiatry in Scotland, an unprecedented and unforeseen increase in the number of people coming forward. Scotland is not alone or unique in facing this. It is a challenge shared by our colleagues elsewhere in the UK and indeed in many other countries. I will reiterate the points that I made, is that we do have a national specification which sets out the standards and expectations of partnership working at the local level. We recognise there have been challenges around implementation, hence the review of implementation and the establishment of that cross-sector task force. I'd be more than happy to keep the member up to date on that work, and indeed we do have the cross-party summit forthcoming to discuss these matters further.
Claire Hockey, to be followed by Ariane Burgess.
Presiding Officer and in my chamber, I am employed as a bank nurse by NHS Greater Glasgow and Clyde. Ensuring adequate staffing levels is key to ensuring a high quality of provision of services. Can the Minister provide an update on current CAMS staffing levels and the Scottish Government's work to invest in our mental health workforce?
Minister.
Certainly, as I touched on earlier, there has been significant investment. Staffing has increased by more than 54.3% to 1,510.9 whole-time equivalent posts, and we have exceeded our commitment to provide funding for 320 additional staff in CAMS by 2026, increasing capacity for cases by over 10,000. We've also provided NHS Education Scotland with over £30 million in 25-26 to continue multidisciplinary education training and support workforce expansion.
Ariane Burgess, to be followed by Jamie Green.
Thank you. Can the Minister clarify how children and young people from marginalised or rural backgrounds are being included in the youth reference groups and strategic boards shaping mental health policy?
Minister.
My clear expectation, indeed our intent, that our work in policy development is reflective of the whole range of Scotland's population, including those in different geographies, and includes consideration of issues pertaining to rurality. I'll be happy to follow up to the member in writing to provide some more specific detail on that.
Jamie Green, to be followed by Jamie Hepburn.
Thank you. If you included the neurodevelopmental waiting times absorbed into the CAMS waiting times, the Government would be missing every single one of those targets. The Parliament Spice Department tell us that over 42,000 children are waiting on an assessment. The average waiting time is 76 weeks. That's a year and a half. Some people are waiting 4, 5, even 6 years for an assessment. It is outrageous, it's atrocious, and frankly, it's shameful. So when we go in to see the actual parity and consistency of access across all local authorities, all health boards, so that every child in Scotland, no matter where they live, have access to diagnosis and the treatment and support that they rightly deserve.
Minister.
The first point I want to make is a neurodevelopmental condition is not a mental health condition. So to suggest that those seeking a neurodevelopmental assessment should be within CAMS is completely incorrect. Child and adolescent mental health services are there. We're talking acute specialist services for acute mental illness. People who have a neurodevelopmental condition does not, by dint of that, does not make them mentally unwell. That is a really important point to make. Now, if someone with a neurodevelopmental condition is comorbid with a mental health condition, of course, CAMS may be the appropriate pathway. But I think it's really important when we're discussing this matter to make a distinction. The second point, and if the member hasn't had the opportunity to consider it, I would strongly recommend reading the paper published by the Royal College of Psychiatrists in Scotland last week, because it makes the point that not only in terms of thinking around a sort of diagnosis-led response and in terms of the mental health system, they make the point that no mental health system in the world could respond to this unprecedented and unforeseen increase in those seeking assessment and diagnosis. And what they recognise is that we need a whole system, whole-of-society approach. And that is what we're absolutely committed to delivering. And with regards to children and young people, the substance of which this statement was concerned with, I've already set forward the work we're doing through the review of the national specification and the cross-sector task force that's been established. And I look forward to engaging with the member at the cross-party summit as well.
Jamie Hepburn, to be followed by Alexander Stewart.
Can the Minister set out what steps have been taken to ensure quality of access to services between different health board areas so that young people can benefit by high-quality services irrespective of where they live in the country?
Minister.
A really, really important point, and I would recognise that there still is variation. We have the national specification that was published some 5 years ago, and we have seen strong progress amongst the overwhelming majority of health boards. Where there are still challenges, government and officials work very closely with health boards to seek to address these challenges, and I give the commitment to the Chamber that that's what we will continue to do.
Alexander Stewart, to be followed by Rona Mackay.
Thank you, Presiding Officer. The statement indicates that there has been considerable improvement in CAM waiting times. However, some children across Scotland are waiting as long as 3 years to access mental health support through the NHS, which is clearly unacceptable. So what guarantees can the Scottish Government give that this announcement today will cut these waiting times, or will we continue to see and leave our children behind?
Minister.
Long waiting times are not acceptable. I've already, both in my statement and in response to questions from other members, highlighted the strong performance we have seen from CAMS, with 3 consecutive quarters now of exceeding the 90% target, and indeed that our median waiting time for between referral and starting treatment down now to 5 weeks compared to 12 weeks before the pandemic. And that reflects significant investment, yes, from the government, but also the fantastic work being undertaken on the ground by CAM staff. As I say, we recognise there is variation within the system, and we are committed to working with health boards to support them to ensure that there is equity of access across all of Scotland.
And Rona Mackay.
Thank you, Presiding Officer. For many young people, the most appropriate forms of support are provided in community settings. Can the Minister say any more about the Scottish Government's work to support community mental health services in Scotland?
Minister. The member makes a really important point. Community-based services are often the most appropriate and most impactful way of addressing those who require support with their mental health. And indeed, they are often the most effective and impactful way of supporting people who are seeking neurodevelopmental support. As I touched on previously, the Scottish Government has provided funding in the region of £160 million over the last 5 years to support community mental health services, both for children and young people and for adults, and indeed young people aged 16 and over are able to access these adult services too.
Thank you, Minister. That concludes the statement on youth mental health support. There will be a brief pause before we move to the next item of business to allow front benches to change.